Hello friends, welcome to CNS Viewpoint. Today we are going to talk about an important fact I read on the World Health Organization website, that out of four vaccine shots, one is being delivered as a booster. So imagine 25% of all vaccines are being delivered as a booster shot. This is really very alarming because many countries have now opened up and have gone making headways into booster administration, which probably to some extent now is in line with the guidelines of the WHO, and also in line with the science and the evidence which has emerged in favor of in providing booster to at least those people whose immunity or immune protection from vaccines might have or is likely to have come down or not at the desired level even after the full vaccination. So some category of people might need additional doses, so such as people who have comorbidities or people with some immune suppression, healthcare workers who are at a much higher and heightened risk, other frontline workers, etc. So but mass administration of booster is not recommended, at least in my knowledge, what I have read on the WHO website or other documents. But there are countries like New Zealand, which have more than half of the population, which have already have had boosters, and there might be many more countries where boosters are being administered since months. So this is also very interesting to see, because it is very sad and deeply disappointing that countries, despite COVID-19 pandemic, which has exposed the inequalities, we are still not able to roll out the vaccines equitably at all. If you look at the last 1 year plus, the way we have rolled out the vaccines, it is not only inequitable, but it also put social justice to shame. And and booster is just one of the way we can look at how despite WHO call for a global moratorium on boosters till the end of 2021, if you look at the data, you will see that many countries, more than 120 countries, were administering booster after booster. This is despite WHO global moratorium. This is unbelievable. More so because 126 countries had boosters in the national recommendations, and over 120 were administering it programmatically. This is very, very surprising, because out of 193 countries, if 120 countries are administering boosters, we also need to see that the countries which are administering boosters, several of these nations have full vaccination rate of less than 30%, when the World Health Organization goal was to achieve 40% full vaccination rate in population of every country by December 2021. So it is clear that a lot of the countries have not yet vaccinated their population fully, at least 40% of their population fully by December 2021, yet they were administering boosters. And some of these countries, although I don't have the list, but I'm just wondering, because the countries which have low vaccination rates are likely to be the countries where COVAX vaccines might have gone, and COVAX has now delivered over 1 billion doses. 1 billion doses have been delivered by COVAX facility of the WHO. So on one hand, they want vaccines from the WHO. They want support and global solidarity from countries to help them fully vaccinate their people. But on the other hand, it is really shocking to see the blatant disregard to global moratorium call till end of December 2021 and on boosters and administration of boosters in such countries. Not only in such countries, administration of booster anywhere which is not backed by science and evidence and based on the principle of equity and social justice, is really deeply problematic. So let us hope we are able to roll out vaccines more equitably, in a socially just manner. Boosters should go as recommended by the WHO to the people who are really in need, where and the categories have been very clearly identified. And people who have not yet administered, who are who have not even got even a single dose of the vaccine, they are the real high priority to get fully vaccinated. And while we do the vaccination, wearing a mask and doing all what is possible to break the chain of transmission of coronavirus remains paramount. So with the hope that we will be able to do the vaccine rollout in 2022 in a more just manner, in a more science-backed manner, let me end today's CNS Viewpoint, and we will be back again tomorrow at 5 p.m. with our thoughts and views and perspectives on something that made us think. Bye till then, and stay safe.